you swallow a 100 milligram pill, the expectation is straightforward. 100 milligrams of medicine enters your system. In practice, human biology has other plans. Your biochemic, the selective barriers of cellular walls, and the strict enzymatic filtration of the liver. Simply introducing an active chemical to the body is ineffective if that compound is destroyed long before it ever reaches the bloodstream. Solving this requires a specialized discipline known as biopharmaceutics, an engineering approach that calculates how a drug's physical form interacts with our internal biology. Every drug must survive a 4-stage life cycle known as ADME: absorption, distribution, metabolism, and excretion. To pass through these stages, the drug must satisfy strict biological criteria, transitioning from a solid object into a mobile, active molecule. This makes the everyday pill a calculated delivery system designed to navigate several layers of biological resistance to reach its target. Designing that system starts with the physical constraints of the human body, specifically the varying pH levels of the gastrointestinal tract and the fatty membranes that protect our cells. The most direct solution is an intravenous injection. By putting the drug straight into a vein, we achieve 100% immediate bioavailability, bypassing the absorption phase entirely. Oral medications simply don't have that luxury. Instead, scientists must manipulate the drug's physical state to dictate exactly how and when it dissolves. This hierarchy shows that liquid solutions are absorbed most rapidly, followed by suspensions, compressed tablets, and finally, delayed-release capsules designed for a slow rollout. By selecting the drug's physical shape, engineers can control the precise timing of the medicinal payload. Once a drug dissolves, it faces its next obstacle, the lipid or fatty walls that line the intestinal cells. Because these walls are made of fat, water-soluble drugs are often repelled. Scientists must ensure a drug is lipid-soluble, allowing it to slip through the cell membrane via passive diffusion. Electrical charge also plays a role. An ionized or charged molecule will bounce off the cell wall, while a neutral, non-ionized molecule passes through without resistance. Using the Henderson-Hasselbalch principle, drugs can be engineered to change their charge based on the local pH. This allows a drug to remain stable and charged in the stomach, but become neutral and absorbable once it hits the intestine. Diazepam is a prime example of this engineering. Its high lipid solubility allows it to cross these fatty membranes rapidly, leading to fast absorption and a quick onset of effect. This chemical charge is a programmable trait, allowing the drug to cross the cellular barrier at the exact right moment. But even entering the bloodstream doesn't guarantee the drug will reach its destination. Inside the blood, the drug encounters plasma proteins like albumin. These proteins act as chemical sponges, physically latching onto the drug molecules as they pass. Any molecule bound to a protein becomes trapped and pharmacologically inactive. It can circulate through the body, but it cannot produce a healing effect. This creates a significant hurdle for distribution. Only the small percentage of free drug that remains unattached is actually capable of reaching the target tissue. Take the blood thinner warfarin. When it enters the blood, 99% of the dose is immediately captured by proteins. Only 1% is left free to work. Scientists must account for this significant reduction, dosing the initial pill so that the remaining 1% is exactly enough to be therapeutic. The bloodstream effectively taxes the dose, and engineers must calculate this loss with absolute precision to ensure the drug remains functional. This balance is highly effective until the internal environment of the patient changes. Factors like liver disease, pregnancy, or age can lower the amount of albumin protein in a patient's blood. If protein levels drop, the trapped warfarin might shift from 99% down to 98%. While that seems minor, the active free drug has just doubled, jumping from 1 to 2%. For a drug as potent as warfarin, doubling the active dose instantly transforms a safe prescription into a life-threatening hemorrhage. This incredibly sensitive mathematical relationship is what governs the safety and efficacy of almost every medication you take. A pill is far more than a simple dose of medicine. It is a piece of precision engineering, a heavily armored, programmable vehicle designed to negotiate a high-stakes peace treaty with the chaotic variables of human biology.